So, thank you for the introduction and thank you for the invitation to be here today. So, ladies and gentlemen, it's a great pleasure for me that I get the opportunity here today to talk about the science and about the mystery of the mind-brain relationship based on recent scientific research on near-death experiences in survivors of cardiac arrest. A near-death experience, or an NDE, or an experience of enhanced consciousness during a period of apparent coma, still give rise to many unbelieving and critical questions, especially by physicians and neuroscientists. Because how can it scientifically be explained that people can have clear consciousness and memories from a period of obvious unconsciousness? Or how is it possible that permanent life changes occur after cardiac arrest of only 2 minutes? As long as one has not experienced an NDE himself, it seems impossible to really understand the impact and the life-changing after effects of this overwhelming conscious experience. The existing worldview has radically changed. Quote, "You can be physically dead, but your mind lives on. Only one thing matters, your attitude toward other people. I accept life as it is, and I'm no longer afraid of death." I will not only talk about changes in consciousness during or after an NDE, but above all, I want to discuss my ideas about a possible relationship between consciousness and the brain. Important questions for me were, how is consciousness related to the integrity of brain function? Is it possible to get insight in this relationship? And is there a biological basis of consciousness anyway? And it is possible to speak of a beginning of our consciousness, and will our consciousness ever end? I realized that my approach will be new and unexpected for most neuroscientists, and that my conclusions will not always be in conformity with the currently widely accepted materialist paradigm in current science. There it is. I also realize that many aspects of consciousness, including the mind-brain relationship, are still a great mystery. Because as the well-known philosopher David Chalmers has said, consciousness, the subjective experience of our inner self, poses one of the greatest challenges for science. Even a detailed knowledge of the brain's working and of neural correlates of consciousness may fail to explain how or why human beings have self-aware minds. The question is, how can scientific research on NDE help us to understand more about the mystery of the mind-brain relationship? By asking this and other questions about consciousness, my interest started in near-death experiences. In 1969, during my rotating internship, a patient was successfully resuscitated in the coronary care unit by electrical defibrillation. We mostly do not realize anymore that about 50 years ago, all patients with cardiac arrest died because of modern resuscitation techniques were not available, like defibrillation or external chest compression. So before 1967, all patients with cardiac arrest have died. Nobody survived a cardiac arrest. But this patient regained consciousness in 1969 after a period of unconsciousness of about 4 minutes. And we as a resuscitation team were very happy. It was all new for us. I was the doctor in charge. But the patient seems to be very, very disappointed. It told me about going through a tunnel, seeing a light and also beautiful colors, and hearing music. I've never forgotten this event, but I did not do anything with it. And in that time, I did not know that in human history, the same experiences have been told in many cultures, in many religions, and in all times, as shown in this painting from 1480 by Hieronymus Bosch, showing deceased people escorted through a tunnel to the light. And only years later, in 1975, Raymond Moody first described these so-called near-death experiences. But only in 1986 I read about these experiences in the book by George Ritchie entitled Return from Tomorrow, which relates what he experienced during a period of clinical death of 9 minutes duration during his medical study. And after reading this book, I started to interview my patients who had survived a cardiac arrest in the past. And to my great surprise, within 2 years, 12 patients out of 50 survivors of cardiac arrest in the past told me about their NDE. So for me, it all started with scientific curiosity. Because according to our current medical concepts, it is not possible to experience consciousness during cardiac arrest when circulation and breathing have ceased. I grew up in an academic environment in which I had been taught that it was obvious that consciousness was a product of a functioning brain. And up until that point, I had always accepted this as indisputably true. But now, the phenomenon of near-death experience raised a number of fundamental questions. How and why does an NDE occur? How does the content of an NDE come about? And why does a person's life change so radically after an NDE? I was unable to accept most of the answers to these questions because they seemed incomplete, incorrect, or unfounded. How does it? Yeah, there it is. No, back. But first, what is a near-death experience, an NDE? Some people who have survived a life-threatening crisis report an extraordinary conscious experience. An NDE can be defined as the reported memory of a range of impressions during a special state of consciousness, including several universal elements, such as an out-of-body experience, pleasant feelings, seeing a tunnel, a light, deceased relatives, a life review, or the conscious return back into the body. And many circumstances are described during which an NDE are reported, like cardiac arrest, clinical death, shock after loss of blood, complicated childbirth, coma following traumatic brain injury or stroke, near drowning, children, or asphyxia, but also NDE-like experiences are reported in serious diseases not immediately life-threatening, during severe depression, during imminent accident, fear of death, as isolation or meditation, or without any obvious reason. An NDE-like experience can also occur during the terminal phase of illness, and are called deathbed features or end-of-life experiences. So apparently you don't always need a non-functioning brain to report an NDE. The NDE is transformational, always causing profound changes in life insight and the loss of the fear of death, and enhanced intuitive sensitivity. Therefore, these kind of experiences are also called spiritual transformative experiences, or STE. Now, near-death experiences occur with increasing frequency because of improved survival rate resulting from modern techniques of resuscitation and from better treatment for patients with cerebral trauma. The content of an NDE and the effects of patients seem similar worldwide, across all cultures and all times. However, the subjective nature, the absence of a frame of reference for this experience lead to individual, cultural, and religious factors determining the vocabulary used to describe and interpret this experience. Children and adults, Christians and atheists, Muslims and Buddhists, they all use different words from their own religion, culture, and tradition. And according to a recent at random poll in Germany and the USA, about 4% of the total population in the Western world should have experienced an NDE. So about 450,000 people in Belgium, more than 10 million people in the USA, and about 20 million people in Europe must have had an NDE. Now, why do we physicians hardly ever hear a patient talk about his NDE? Patients are so reluctant to share the experience with others by all the negative responses they get. Patients must feel that you trust them, that you can listen without any comment or prejudice. But for most physicians, the NDE is still an incomprehensible and unknown phenomenon. Once a conference was held about NDE in a university hospital with more than 300 people in attendance. And at the end of the conference, after several lectures about NDE, a man stood up and said, "I'm a cardiologist for more than 25 years, and I've never heard such absurd stories. This is total nonsense. I don't believe one word of it." And then another man got up in the audience and he said, "I'm one of your patients. I have had an NDE during cardiac arrest, and you would be the last one I would ever tell." They know exactly intuitively that these kind of doctors are not able to listen at all. Now, until recently, there was no prospective and scientific designed study to explain the cause and content of an NDE. All studies had been retrospective and very selective in respect to patients. Based on this incomplete retrospective studies, some believed that the experience could be caused by physiological changes in the brain because of lack of oxygen, cerebral anoxia. Other theories encompass a psychological reaction to approaching death, hallucination, dreams, side effects of drugs, or just false memories. So in 1988, we started a prospective study with 344 consecutive survivors of cardiac arrest in 10 Dutch hospitals, with the aim to investigate the frequency, the cause, and the content of an NDE. This cartoon was published in a Dutch national newspaper when our study was published in The Lancet in December 2001. We wanted to know if there could be a physiological, pharmacological, psychological, or demographic explanation why people experience enhanced consciousness during a period of cardiac arrest. And we did a short standardized interview with sufficiently recovered patients within a few days of resuscitation, and asked whether they could remember the period of unconsciousness and what they recalled. We additionally performed a longitudinal study. There it is. So we studied patients who survived a cardiac arrest, because this is a well-described, life-threatening medical situation, which is also called clinical death. And the definition of clinical death was used for the period of unconsciousness caused by lack of oxygen in the brain due to the arrest of circulation and breathing that happens during cardiac arrest in patients with an acute myocardial infarction. These patients will ultimately die from irreversible damage to the brain if cardiopulmonary resuscitation, CPR, is not initiated within 5 to 10 minutes. It is the closest model of the process of dying. We found that 282 patients, 82%, had no recollection of the period of cardiac arrest, of the period of unconsciousness. However, 62 patients, 18%, reported some recollection of the time of clinical death. And of these patients, 41 patients, 12% had a core experience with a score of 6 or higher, and 6% had a superficial NDE. And all well-known elements were reported, like awareness of being dead, positive emotions, an out-of-body experience, moving through a tunnel, communication with the light, an observation of colors or of a celestial landscape, a meeting with deceased relatives, a life review, and the experience of a border. And the more elements were reported, the deeper the experience was. Now, what might distinguish the small percentage of patients who report an NDE from those who do not? We found to our surprise that neither the duration of cardiac arrest, 2 minutes or 8 minutes, nor the duration of unconsciousness, 5 minutes or 3 weeks in coma, nor the need of intubation in complicated CPR, nor a short induced cardiac arrest in electrophysiological stimulation, EPS, had any influence on the frequency of NDE. So the degree or gravity of the lack of oxygen in the brain, anoxia, appeared to be irrelevant. And so a physiological explanation for NDE, like anoxia in the brain, could ultimately be excluded with certainty. And neither could we find any relationship between the frequency of NDE and administered drugs, fear of death before the arrest, nor fallenness of NDE, that you know that these experiences are possible, gender, religion, being a Christian or atheist did not matter at all, or education. And we additionally performed a longitudinal study with taped interviews 2 and 8 years following the cardiac arrest of all late survivors with NDE, along with a matched control group of patients who survived a cardiac arrest but did not report an NDE. The study was designed to assess whether the loss of the fear of death, the transformation and attitude toward life, and the enhanced intuitive sensitivity is the result of having an NDE or just the result of the cardiac arrest itself. This had never been studied before in a prospective design. The NDE turned out to be a life-changing experience because only patients with an NDE did show this typical transformation. They were less afraid of death and had a stronger belief in an afterlife. We saw in them a greater interest in spirituality and questions about the purpose of life, as well as a greater acceptance of and love for oneself in combination with the feeling of oneness with others and with nature. The conversations we had in our longitudinal study revealed that people, often to their own amazement and confusion, had acquired enhanced intuitive feelings after an NDE, or as many of them put it, they had acquired paranormal gifts. This enhanced intuition is based on interconnectedness with the consciousness of others and is independent of time, in a knowing of future events or having prognostic dreams. It is independent of distance, the sense of knowing the future, of knowing about an incoming phone call or of pain, illness, of upcoming death of people, which usually proves to be accurate. The sudden occurrence of this enhanced intuition can be quite problematic, as people suddenly have a very acute sense of others, which can be extremely intimidating. As someone told me, I couldn't even talk about it, or I would have been committed to an institution. And I know patients who had been committed to a closed institution for psychiatric patients. Finally, it is quite remarkable and a surprising and unexpected finding to see a cardiac arrest lasting a few minutes give rise to such a lifelong process of transformation. However, the integration and acceptance of an NDE is a process that may take many years because of its far-reaching impact on people's pre-NDE understanding of life and value system. Despite the mostly positive experience, the NDE is also a traumatic event because there's hardly any acceptance by doctors, nurses, family, and partner, with a divorce rate of more than 70% because the partner says it's not the same patient, not the same person as married before. which makes the process of acceptance and integration very difficult. And this process will take many, many years with strong feelings of depression, homesickness, and loneliness. But the longer the interval between NDE and the interview, the more positive changes are usually reported. In 4 prospective studies with identical study design, our Dutch study, which is the only study with statistical analysis, 1 study from the USA, and 2 studies from the UK, about the same percentage of NDE was found in a study of a total of 562 patients who had survived a cardiac arrest. And all authors conclude that no one physiological or psychological model by itself could explain all the common features of an NDE. Bruce Grayson from the USA writes in his comments that the paradoxical occurrence of heightened lucid awareness and logical thought processes during a period of impaired cerebral perfusion raises particular perplexing questions for our current understanding of consciousness and its relation with brain function. A clear sensorium and the complex perceptual processes during a period of apparent clinical death challenge the concept that consciousness is localized exclusively in the brain. And some part of Peter Fenwick from the British study write that the data from several NDE studies suggest that the NDE arises during unconsciousness. And this is a surprising conclusion, because when the brain is so dysfunctional that the patient is deeply comatose, those cerebral structures which underpin subjective experience and memory must be severely impaired. Complex experiences, such as our reported NDE, should not arise nor be retained in memory. Such patients would be expected to have no subjective experience at all. Penny Sartori from the other British study concludes that according to mainstream science, it is quite impossible to find a scientific explanation for the NDE as long as we believe that consciousness is only a side effect of a functioning brain. The fact that people report lucid experiences in their consciousness when brain activity has ceased is, in her view, difficult to reconcile with current medical opinion. So with lack of evidence for any other theory for NDE, the concept, this far assumed but never scientifically proven, that consciousness and memories are produced by large groups of neurons and are localized in the brain, should be discussed. How could a clear consciousness outside one's body be experienced at the very moment that the brain no longer functions during a period of clinical death, even with a flatline EEG? Scientific study of NDE pushes us to the limits of our medical and neurophysiological ideas about the range of human consciousness and the mind-brain relationship. And NDE might be considered as a changing state of consciousness based on the theory of continuity, in which memories, identity, cognition with emotion function independently from the unconscious body and retain the possibility of extrasensory perception. Obvious, during NDE, enhanced consciousness experience independently from the normal body-linked waking consciousness. Before I discuss in greater detail some neurophysiological aspects of brain function during cardiac arrest, I would like to reconsider certain elements of an NDE. First, the out-of-body experience. In this experience, people have veridical perceptions from a position outside and above their lifeless body. NDEs have the feeling that they have apparently taken off their body like an old coat. And to their surprise, they appear to have retained their own identity with the possibility of perception, emotions, and a very clear consciousness. And this out-of-body experience is scientifically important because doctor, nurses, relatives can verify the reported perceptions, and they can also corroborate the precise moment the ND with OBE occurred during the period of CPR. In 2 reviews with a total of more than 200 corroborated reports of potentially verifiable out-of-body experiences, it was found that about 98% of the reported OBEs were completely accurate. Through verification, it was proven that all reported perceptions during coma, during cardiac arrest, and during general anesthesia were about details that really had happened. And based on these veridical aspects, an OBE can be, by definition, not be an hallucination, not be a delusion, nor an illusion. And moreover, one needs a functioning brain to have hallucinations, delusions, or illusions. A real OBE is clearly shown in this drawing of a 6-year-old girl who nearly drowned and was resuscitated in a hospital. In this drawing, you see a happy and smiling girl. Which one is it? Oh yeah. Yeah, a happy smiling girl above, looking at her own resuscitation, where he had drawn 2 nurses who were doing external chest compression. A 6-year-old girl doesn't know anything about CPR. And this is a report of a nurse of a coronary care unit. During night shift, an ambulance brings in a 44-year-old cyanotic, comatose man into the coronary care unit. He was found in coma about 30 minutes before in a meadow. When we go to intubate the patient, he turns out to have dentures in his mouth. I removed these upper dentures and put them onto the crash cart. Only after about an hour and a half, the patient had sufficient heart rhythm and blood pressure, but he is still ventilated and intubated, and he is still comatose. So he is transferred to the intensive care unit to continue the necessary artificial respiration for 1 week. So after more than a week in coma, do I meet again with the patient who is by now back on the cardiac ward. The moment he sees me, he says, "Oh, you know where my dentures are." I'm very surprised. And then the patient elucidates, "Yes, you were there when I was brought into hospital. And you took my dentures out of my mouth and put them onto that cart. It had all these bottles on it. And there was this sliding drawing underneath. And there you have put my teeth." I was especially amazed because I remember this happening while the man was in deep coma and in the process of CPR. It appeared that the man had seen himself lying in bed, that he had perceived from above how nurses and doctors had been busy with his CPR. He was also able to describe correctly and into detail the small room in which he had been resuscitated, where he was admitted in coma and had left in coma, as well as the appearances of those present, like myself. Then the holographic live review. During this live review, the subject feels the presence and renewed experience of not only every act, but also of every thought from one past life. And one realizes that always it is an energy field which influences oneself as well as others. All that has been done and thought seems to be significant and stored, because one is connected with the memories, emotions, and consciousness of another person. You experience the consequences of your own thoughts, words, and actions to that other person at the very moment in the past that they occurred. Interconnectedness. Patients survey their whole life in one glance. Time and space thus do not seem to exist during such an experience. Non-locality. Quote, "All of my life up till the present seemed to be placed before me in a kind of panoramic, 3-dimensional review, and each event seemed to be accompanied by consciousness of good or evil, or with the insight into cause and effect. Not only did I perceive everything from my own viewpoint, but I also knew the thoughts of everyone involved in the event, as if I had their thoughts within me. This meant that I perceived not only what I had done or thought, but even in what way it had influenced others, as if I saw things with all-seeing eyes. And so even your thoughts are apparently not wiped out. Think about it for a moment. Your thoughts are never wiped out. And all the time during the review, the importance of love was emphasized. Looking back, I cannot say how long this live review and live insight lasted. It may have been long, because every subject came up, but at the same time it seemed just a fraction of a second, because I perceived it all at the same moment. Time and distance seemed not to exist. I was in all places at the same time, and sometimes my attention was drawn to something, and then I would be present there. And it's also possible to be in contact with the consciousness of deceased persons. Interconnectedness. Quote, during my cardiac arrest, I had an extensive experience. And later I saw, apart from my deceased grandmother, a man who had looked at me lovingly, but whom I did not know. More than 10 years later, at my mother's deathbed, she confessed to me that I had been born out of an extramarital relationship. My father being a Jewish man who had been deported and killed during the Second World War. And my mother showed me his picture. The unknown man that I had seen more than 10 years before during my NDE turned out to be my biological father. And then some patients can describe how they returned into their body, mostly during the top of the head, after they had come to understand that it wasn't their time yet, or they had still a task to fulfill. The conscious return into the body is experienced as something very oppressive. They regain consciousness in the body and realize that they are locked up in the damaged body again, meaning again all the pain and restrictions of their disease. Quote, when I came to in my body, it was dreadful, so dreadful. The experience had been so beautiful that I didn't want to come back. I wanted to stay there, and yet I came back. And from that moment, it was a real struggle to live my life inside my body with all the limitations I experienced at the time. But later I realized that the experience was in fact a blessing. For now I know that the mind and body are separate, and that's their life after death. So about all people who have experienced an NDE lose their fear of death. Quote, it is outside my domain to discuss something that can only be proven by death. For me, however, this blessing experience was decisive in convincing me that consciousness lives on beyond the grave. And I know now for sure that mind and body are separated. Death was not death, but another form of life. So we must come to the surprising conclusion that in our study during cardiac arrest, all these reported elements of an NDE were experienced during a transient functional loss of all functions of the cortex and of the brainstem, with a flatline EEG. But how do we know that the EEG, the registration of the electrical activity of the cortex, is flat in those patients with cardiac arrest? And how can we study this? Through many studies with induced cardiac arrest in both humans, like in threshold testing of ICDs, and in animals models, cerebral function has been shown to be severely compromised during cardiac arrest, with complete cessation of cerebral flow within 1 second, the Doppler on the carotid artery, causing the clinical findings of the sudden loss of consciousness, the loss of breathing, apnoea, the loss of all body reflexes, a function of the cortex, but also the loss of all brainstem reflexes, like the gag reflex, the quarter reflex, and fixed and dilated pupils. The electrical activity in the cerebral cortex, but also in the deeper structures of the brain in animals, has been shown to be absent after 10 to 20 seconds, a flatline EEG. And in an acute myocardial infarction, the duration of cardiac arrest is always longer than 20 seconds. Mostly takes 1 to 2 minutes, but usually even much more. So all 562 survivors of cardiac arrest in the 4 prospective studies must have had a flatline EEG. Now, it's extremely rare that a simultaneous registration of the electrical activity of the heart, which is the red line up here, and of the brain, the EEG, the black line up here, could be monitored. A patient was referred because of certain periods of unconsciousness, and during a registration of 60 seconds each, is 10 seconds each strip, a spontaneous cardiac arrest systole occurs up here, and the patient loses consciousness. The EEG changes after 8 seconds. It's clearly different. And after 60 seconds, the EEG is also a flat line. And then after 30 seconds, occurs a short ventricular tachycardia, then a slow coming back of cardiac rhythm, and it takes much more time for EEG to normalize. This is still abnormal. The patient received a pacemaker, after which he remained complaint free. The conclusion about conscious experience during a flatline EEG is often called impossible and unscientific. The quite often proposed objection that the flatline EEG does not rule out any brain activity because it is mainly a registration of the electrical activity of the cerebral cortex misses the mark. The issue is not whether there is any brain activity of any kind whatsoever, but if there is the measurable brain activity of the specific form regarded by contemporary neuroscience as a necessary condition of conscious experience, with visible activity in many neural centers, the so-called global neural workspace. And it has been proven that there is no such specific and dynamic brain activity at all during cardiac arrest. So for me, it was indeed a scientific challenge to discuss new hypotheses that could explain the possibility to have a clear and enhanced consciousness during a transient period of a non-functioning brain, with memories, with self-identity, with cognition, with emotion, with the possibility of perception out and above the lifeless body. To explain the reported interconnectedness with the consciousness of other persons and of deceased relatives. To explain the possibility to experience instantaneously and simultaneously non-locality, a review or even a preview of someone's life in a dimension without a conventional body-linked concept of time and space. Present and future events exist. And even to explain the experience of the conscious return into the body. Here I would like to quote Robert Oppenheimer, the famous American theoretical physicist, who has said, "There is no place for dogma in science. The scientist is free and must be free to ask any question, to doubt any assertion, to seek for evidence, and to correct any errors." But most scientists still don't believe in the possibility to experience an enhanced consciousness during a period of a non-functioning brain, because they cling to their own materialist dogma. And so they try to debunk everything I have said and written by simply stating that according to their current dogma, it is obvious that NDE must be produced by the brain. They only change their mind as soon as they have experienced an NDE themselves, like Eben Alexander and many other physicians. I've met many physicians who had an NDE. So my advice to these debunkers is try this small and dangerous footpath and find out yourself. In my book Endless Consciousness, Eindeloos Bewustzijn, which was published in 2007 in the Netherlands, and was translated into English as Consciousness Beyond Life. In French it is Mort ou Pas. It's a worldwide bestseller, now being published in 11 languages and with more than 350,000 copies sold. In my book I have written that based on prospective studies on NDE, based on recent findings in neurophysiological research, and in analogy with concept from quantum physics, our consciousness cannot be localized in a certain time or space. This is called non-local consciousness because almost all the reported aspects of consciousness during cardiac arrest seem to be quantum-like phenomena, like non-local interconnectedness beyond time and space. In this concept, our endless or non-local consciousness with declarative memories find its origin in and is stored in a non-local realm as wave fields of information. And the brain only serves as a relay station for parts of these wave fields of consciousness to be received into or as our waking consciousness. The function of the brain should be compared with a transceiver, a transmitter-receiver, or interface, exactly like the function of a computer. Different neuronal networks function as interface for different aspects of our consciousness. And the function of neuronal networks should be regarded as receivers and conveyors, and not as producers of memories and consciousness. And this concept, non-local consciousness, is not rooted in the measural domain of physics, our manifest world. However, the physical aspects of consciousness, which originates from the wave aspect of consciousness through collapse of the wave function, objective reduction, can be measured by means of neuroimaging techniques like EEG, fMRI, and PET scan, which are neural correlates. With this concept of non-local consciousness, which is also the concept of the continuity of consciousness, all reported elements of an NDE during cardiac arrest could be explained. Now, in trying to understand this concept of interaction between non-local consciousness and the material body, it seems appropriate to compare it with modern worldwide communication. There's a continuous exchange of objective information by means of electromagnetic fields for radio, television, mobile telephone, or laptop computer. And at this very moment, we are invaded with hundreds of thousands of telephone calls and hundreds of radio and television programs. But we become only aware of these electromagnetic informative fields at the moment we use our mobile telephone or by switching on our radio, television, or laptop computer. What we receive is neither inside the instrument nor in the components, but thanks to the receiver, the information from the electromagnetic fields, the cloud, becomes observable to our senses, and hence perception occurs in our consciousness. Internet with more than 1 billion websites can be received in about the same moment in the USA, in Europe, and in Australia, and it is obvious not located inside our laptop, nor is it produced by it. Information from internet is always and everywhere available because it is stored in the cloud. The cloud can be compared with non-local consciousness. It is always everywhere available. An NDE, or an experience of enhanced or non-local consciousness during a life-threatening situation like cardiac arrest or coma, and also during general anesthesia, makes it extremely unlikely that consciousness could be a product of the function of the brain. Based on these experiences, it seems inevitably to suggest that there will be a continuity of consciousness after death, but also experiences of an enhanced consciousness just before, during, or after death support this conclusion. First, the deathbed features or end-of-life experiences, or ELA. During the terminal phase of illness, patients sometimes report encounters with deceased loved ones who welcome them, or the sight of a beautiful, unearthly environment, or a bright light. The sense of unconditional love, or sometimes experiences of only compromise of vague, intuitive images, and an inner sense that the moment of transition is near. Like an NE, such an end-of-life experience takes away the fear of death. Unfortunately, many accounts of ELEs are either not recognized as such or are interpreted as hallucinations, terminal confusion, or side effects of medication. And then terminal lucidity, of paradoxical lucidity. This is the experience of an expected return of mental clarity and memory shortly before death in patients suffering from severe neurological disorders, like the end stage of Alzheimer's disease. These patients suddenly become lucid again, recognize family members and children again, call them by name, thank them, and die. Terminal lucidity cannot be easily explained by normal neurological processes, because it has been reported by patients who had severe Alzheimer's disease for many years, or are in coma for days, and these patients' brain function must be severely impaired. Then a shared death experience can be reported by healthy people who are present at the bedside of a dying relative, and who share the death experience of this close relative at the moment of their death. They occasionally see a very special light in the room or around the bed of the dying person with primary qualities of bliss, compassion, and unconditional love. But sometimes they also join the death experience of the person who just died. They may experience a tunnel, the light, the feeling of love, and even sometimes meet deceased relatives or the life review of the person who just died. But suddenly they are back in the healthy body again at the bedside of the person who died just some minutes before. And that spiritual experience of contact with the consciousness of beloved persons who is dying somewhere else are called perimortal experiences. Sometimes visions or a strong sense of the dying person from a long distance is perceived, mostly during sleep at a very clear so-called dream, or a sudden awakening from sleep. To understand this experience, we must step outside the current materialistic scientific framework. And then the so-called post-mortem experience or after-death communication, ADC. This is the feeling or inner knowing to be in contact with the consciousness of a deceased loved one in the first days, weeks, or months following his or her death. This contact consists of sense of presence, feeling touched or even seeing the deceased person. It is sometimes accompanied by communication, certain flagrances or unexpected chance incidents that are intuitively linked with the dead person. These experiences mostly occur during sleep, and therefore they usually call it just a dream. But people will share this experience only when they feel a great deal of trust and know that they will not be at the receiving end of prejudices or negative comments, like it's just willful thinking or it's just your grief talking. In our Western society, it is still a taboo to talk about the sensation of being in contact with deceased loved one, even though about 125 million people in Europe and about 100 million people in the USA must have had an after-death communication. The fact that contact is possible with the consciousness of a deceased relative is usually very comforting and helpful in a period of mourning. And healthcare workers or family members should not call an ADC an hallucination. There's no scientific explanation for these ADCs if we still believe that consciousness is only a side effect of a functioning brain. Research in any ELE or ADC may be of great help to change our ideas about death, because based on these experiences, it seems now beyond reasonable doubt that there must be a continuity of consciousness after the death of the body. Since the publication of several prospective studies in NDE and survivors of cardiac arrest, with strikingly similar results and conclusions, the phenomenon of the NDE can no longer be scientifically ignored. It is an authentic experience which cannot be simply reduced to imagination, fear of death, hallucination, psychosis, the use of drugs, or oxygen deficiency. And people appear to be permanently changed by an NDE during a cardiac arrest of only some minutes duration. According to these studies, the current materialistic view of the relationship between the brain and consciousness held by most physicians, philosophers, and psychologists is too restricted for a proper understanding of this phenomenon. Materialist science starts principally from a reality that is only based on physical, observable data. But we should be aware that besides external and so-called objective perception and observation, there are also subjective, not observable, and not demonstrable aspects like thoughts, feelings, inspiration, and intuition. We can only measure the electrical, magnetic, and chemical activities in the brain by EEG, MEG, and PET scan, and we can measure changes in blood flow in the brain by fMRI. But these are only neural correlates of consciousness. These measurements do not explain anything about the production nor about the content of consciousness. With the currently available scientific and objective techniques, one is not able to prove, to measure, to objectify nor falsify the content of our subjective experiences in our consciousness. Direct proof about how neurons or neuronal networks could possibly produce the subjective essence of our thoughts and feelings is totally missing. By making a scientific case for this continuity of consciousness, we must question a purely materialist paradigm in science. And it seems to be important for our scientific ideas about the mind-brain and mind-body relationship. It is also evident that it is important for our concepts of life and death because of the almost unavoidable conclusion that at the time of physical death, consciousness will continue to be experienced in another dimension in which all past, present, and future is enclosed. Quote, "Death is only the end of our physical aspects." I believe now that death, like birth, may be a mere passing from one state of consciousness into another. However, we should acknowledge that research on NDE cannot give us the irrefutable scientific proof of this conclusion, because people with an NDE did not quite die, but they were all very close to death and without a functioning brain. So it has now indeed been scientifically proven that during NDE, enhanced consciousness was experienced independently of a functioning brain. Without a body, we still can have conscious experiences. We are still conscious beings. In conclusion, we have a body and we are consciousness. Recently, someone with an NDE wrote to me, "I can live without my body, but apparently my body cannot live without me." The NDE seems to be a personal rediscovery of wisdom and insight that is ages and ages old and has been well known in many cultures and all times, but nowadays seems to be forgotten. I would like to quote Plato, who wrote more than 2,000 years ago, "The temporary material body is the temporary carrier of our immortal soul. Time doesn't exist in the immaterial world." 2,000 years ago. So based on scientific research on NDE, I cannot avoid the conclusion that endless consciousness has been and always will exist independently from the body. There's no beginning, nor will there ever be an end to our consciousness. Our enhanced consciousness resides not in our brain and is not limited to our brain, because our consciousness is non-local and our brain has a facilitating function and not a producing function to experience consciousness. According to this view, the brain has a permissive or transmissive function like a filter. It admits or transmits information. Today, more and more cognitive scientists, neuroscientists and philosophers come to the inevitable conclusion that it is extremely unlikely that consciousness could be a product of brain function, which confirms what the Australian neurophysiologist, philosopher and Nobel Prize winner Sir John Eccles once has stated. The brain is a messenger to consciousness. And interestingly, the English physicist, astronomer and mathematician Sir James Jeeves wrote already many years ago, I incline to the idealistic theory that consciousness is fundamental, that the material universe is derivative from consciousness, and not consciousness from the material world. And even in 1931, the famous Nobel Prize winner and originator from quantum theory Max Planck has said, I regard consciousness as fundamental. I regard matter as derivative from consciousness. We cannot get behind consciousness. Everything that we talk about, everything that we regard as existing, postulates consciousness. And this is again confirmed by Donald Hoffman, an American cognitive scientist, who has written, conscious realism is a non-physicalist monism. Consciousness is ontologically fundamental. Consciousness is first. Matter and fields depends on it for their very existence. In the past, a lot have been written about life and death, and also about special states of enhanced or non-local consciousness. But surprisingly, many people nowadays still have never heard about NDEs or after-death communications, and this is why they still believe that death is the end of our existence and the end of our consciousness. People are afraid that with death everything comes to an end. As a young doctor, this was also my idea about death. But based on the results and conclusion of recent NDE research, my current view is now there are good reasons to assume that our consciousness does not always coincide with the functioning of our brain. Enhanced consciousness can sometimes be experienced separately from the body. And remarkably, in a recent representative social poll in Europe, about 55% of the population, more than 250 million people in Europe, believed in some kind of personal survival. And in the USA, this percentage is even higher. These surprising high figures are in sharp contrast with the opinion of most Western scientists, who systematically ignore and ridicule the possibility of personal survival after physical death. The current materialistic view on the mind-brain relationship is too restricted for a proper understanding of the NDE. We need a new post-materialistic approach to expand consciousness in science, to accept these concepts, but new ideas are usually ridiculed or neglected, as the physician Ian Stevenson, who published a lot about reincarnation, once stated. It has been said there is nothing so troublesome as a new idea, and I think that's particularly true in science. And even more than a century ago, William James has said, first, a new theory is attacked as absurd. Then it is admitted to be true, but obvious and insignificant. And finally, it is seen to be so important that its adversaries claim that they themselves discovered it. And I sincerely hope that quantum physicist Max Planck was wrong when he said in 1934, a new scientific truth does not triumph by convincing its opponents and making them see the light, but rather because its opponents eventually die and a new generation grows up that is familiar with it. You are the young and new generation sitting here. So we desperately need a real paradigm shift in science. We need to expand science as soon as possible to be able to include subjective experiences. Regarding what has been learned, we can learn from people who are willing to share the ND or after-death communication with others. I would like to quote Dag Hammarskjöld. Our ideas about death define how we live our life. Because we believe that death is the end of everything we are, we will give our energy toward the temporary and material aspects of our life. And our short-sightedness and sometimes willful ignorance, we forget to reflect about the future of our planet, where our children and our grandchildren will have to live and survive. We forget about sustainability, as we are now destroying and exhausting systematically our planet just because we are living in a competitive and materialistic society. We should realize that the harm we cause to each other and to nature ultimately is harming ourselves, because as humans are not only intensively interconnected and tangled with each other, but also with animals and plants living on our endangered earth. I hope that in the near future we will accept non-local concepts to understand how we are and always will be interconnected with each other, also after physical death. That we have to change our personal consciousness, not only to change the way we live, but also to change the way we want to respect people who are willing and able to share the near-death experience, end-of-life experience, or after-death communication with us. Their lives changed in ways they were not prepared for. And they all tell us that they fundamentally changed the ideas about life and death. Because, quote, you can be physically dead, but your mind lives on. And another quote, death was not death, but another form of life. Consciousness seems to be our essence. And once we leave our body, we leave our physical world, we exist as pure consciousness, beyond time and space. We are enfolded in pure, unconditional love. Obviously, this new insight helps us to better understand the concept of the continuity of consciousness. And as a woman with an NE wrote to me, when the power of love becomes stronger than our love for power, our world will change. And this will require a huge change in consciousness indeed. We should all feel the responsibility for this change. Thank you for your attention.